The WHO classification of lung cancer is the framework, it's the set of rules that we use in making our diagnosis of the different types of lung cancer. The classification is primarily designed for the diagnosis of surgically resected lung cancers, but we have included in the classification a completely new section which discusses the challenges and the solutions to diagnosing at an accurate and specific level different types of lung cancer in small biopsies and cytology specimens. And probably this introduction is certainly one of, if not the most important change in the WHO classification, because after all, most of our patients do not have surgically resected disease and rely entirely on a diagnosis based on small biopsy samples. One of the other really fundamental changes that has been made in the diagnosis on surgically resected specimens is the use of immunohistochemistry, really as a defining feature of certain types of tumour, primarily adenocarcinoma and squamous carcinoma in certain circumstances. Immunohistochemical features are now accepted as defining criteria for one type of tumour or the other. There have been a few other changes introduced, some of which are familiar to us from previous publications on adenocarcinoma, for example. But in the main, I think those changes that I have described are the main ones and probably the most impactful for clinical practice.